Hello there, and a warm welcome to this eMHIC webinar. Good morning, good afternoon, good evening, wherever you are in the world. My name, for those of you who don't know me, is Fiona Costello, and it's my pleasure to be your host for today's chat entitled Digital Mental Health in Action, eMHPSS in Humanitarian Settings and AI-Driven Mental Health Support for Kurdish-Speaking Communities. This webinar has a crucial and timely focus, the role of digital mental health in crisis response and humanitarian settings. Our presenters will discuss two exciting projects currently underway at Koya University in Iraq. The first focuses on developing standardized guidelines for electronic mental health and psychosocial support, eMHPSS, in humanitarian settings. These guidelines aim to address treatment protocols, ethical concerns, data security, accessibility, and infrastructure challenges, with leadership proposed from renowned global health organizations like the WHO and the United Nations. The second project involves developing an AI-powered mental health chatbot designed for Kurdish speakers, a population with severely limited access to mental health support. You will hear from our speakers very soon, but first I have a few quick points to mention as always. Firstly, feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose Edit, and add your country or area. This allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, please feel free to post them in the Q&A box. During the Q&A session, I will do my best to include as many of them as possible in our discussion. And lastly, today's webinar is being recorded, and the eMHIC team will soon share the recording in the Knowledge Bank. So now it gives me great pleasure to introduce the first speaker, Mr. Daria Ahmed. Daria is a clinical psychologist, mental health consultant, and researcher at Koya University. He has published extensively in high-impact journals and serves as an editor and peer reviewer. Currently, he leads research on electronic mental health and psychosocial support in humanitarian crises, AI-driven mental health solutions for Kurdish speakers, trauma, and suicide prevention. He is also the founder and president of the Axon Foundation for Research and Development. Daria is now going to provide us with an introduction to his work on developing eMHPSS guidelines for humanitarian settings. And hopefully Daria will be joining us now. Thank you, Daria. Over to you.
Yeah, thanks, Fiona, for the great introduction. I'm very happy to be with you here to talk about our digital mental health project. So first of all, I'd like to thank eMHIC to be an umbrella for all agencies, NGOs, and foundations and people who love to work on digital mental health. So we are happy to give introduction and the hints about our digital mental health projects. Can you hear me? Should I start sharing my screen?
Yes, please, Daria, if you can.
Yes.
Perfect.
Can you see my screen now?
Yes.
Great. Yeah, here, me and my colleague, Dr. Halgur from Koya University, we have two different digital mental health projects. One for humanitarian settings called electronic mental health and psychosocial support, in brief, eMHPSS, and the other one is a Kurdish chatbot for mental health assistance. So I'm going to talk about eMHPSS, and my colleague, Dr. Halgur, will talk more about the Kurdish chatbot. So first of all, for all the audiences, I would like to give a short introduction or brief history about the digital mental health, because for some people maybe they are thinking this is very new, but it's important to know in which year the digital mental health initiated. So first of all, why the digital mental health is important. Currently, there's 27 war and conflicts happening in the world. And this is a risk factor for for making more mental health problems, making more migration and more vulnerable people suffering from mental health disorders. So that's why there's a great need for mental health assistance globally because of the prevalence of depression, anxiety, PTSD, trauma, etc. And the first initiatives for the digital mental health back to like more than 5 decades ago in 1970s in the United States of America, in the Nebraska, when the first two-way video system was installed between the teaching hospital and the rural clinic area, which was very difficult for the people in this rural area to join the hospital to get the health assistance, especially the mental health assistance. So the first remote online therapy happened in 1970s in the Nebraska. So this means that digital mental health is not very new. So back to like more than 5 decades ago. But the demand of the digital mental health or the popularity of digital mental health remained unpopular until 2010, when there's many studies have been conducted and many papers published between 2005 and 2013 to demonstrate how patients is liking to join the remote or online therapy. So especially after 2010, digital mental health is beginning to evolve. In many areas, these are the remote areas that which they has very like mental health professionals or no hospitals or PHCCs. So they started to use the online therapy sessions with the mental health professionals. But the peak area or the peak time or the golden time for the digital mental health back to COVID-19 pandemic in 2020. So when everything is locked down and all, the COVID-19 pandemic impacted significantly the mental health of people when they isolated from home. So they started to joining the online therapy sessions, and many companies try to provide telemental health, and especially during the humanitarian settings when we work with the IDPs or refugees in the campus and everything was locked down, we couldn't to reach to people in need when they need the mental health assistance. So all the agencies, they try to provide tele mental health or tele-psychiatry or digital mental health. So COVID-19, it was a golden time for evolving the digital mental health. Why the digital mental health is important, the advantage of the digital mental health. So, digital mental health is important, especially for some areas like the conflict zone areas and the areas with lack of mental health professionals and the areas with lack of mental health facilities. So if you have a digital mental health, it's expanding access to care and ability to reach. So you don't need the logistical barriers or security barriers. You can get access to the digital mental health anytime you want. And the service is more flexible and available, especially during where's the point? I don't know. Anyways, service more flexible and available anytime if you want. For example, if the areas have no mental health professionals or no mental health community centers, you can just, through the phone call or the other communication means, you can reach to the mental health professionals. One of the problem in the mental health we have is stigma, a social stigma. When someone having the mental health problems, is like a taboo in some, this is a global problem, but it's more significant in some areas in the world. So they don't want to go to the hospital or to psychologist or psychiatrist to seeking for support. But digital mental health is helping to reduce stigma because you don't need to walk with the hospital or people see you, or even you can do it through phone call without video call, so nobody knows your ID. Another advantage of the digital mental health is patient can receive care from the privacy, as I mentioned. So from my home, from my room, I can receive the assistance without, any privacy issues. It's more confidential than you are going to see doctors in person. And convenience for patients and clinical providers. As you said, there's um, flexible schedules you can get for yourself. Yeah, flexible schedules um, and great. Okay, and providers can offer large, a large patient pool. For example, if you are working in the clinic, the patient should wait for you and then come join the sessions. But for the remote assistance, you can, reducing this crowding in the clinics and hospitals. You can, dividing them to this flexible schedules, and also cost saving. And remote assistant, the digital mental health is not like the traditional one. You don't need to take a taxi, go to the hospital, to go to the other cities and come back. It's cost effective. But digital mental health, it helps you to save your money. Also, at the same time, we have challenges, to providing digital mental health. Sometimes it's technical barriers. Maybe nobody have the high internet, speed internet, or the communication means, or the devices, or the electricity. Maybe this is one of the problems we are facing during providing mental health assistance, especially during the humanitarian crisis. All patients have access to technologies that necessary for the digital mental health, or maybe some people still they don't know how to use the digital mental, especially if you have a platform or the website, you have to book your sessions, etc. Maybe some people having difficulty to do that. They need assistance. And some people, maybe they concern about privacy and confidentiality. They're afraid that their names and pictures being hacked. This maybe some people have concern about the confidentiality. And also the digital mental health, still in some countries we don't have regulations for law and rules and regulations for digital mental health. Maybe some people seeing this a challenge and not joining the digital mental health assistance. And also patients may be worried about the confidentiality of online platforms. As I said, maybe they are afraid of hacking and etc. eMHPSS, or electronic mental health and psychosocial support. This is one of our digital mental health projects we are designing specifically for humanitarian settings. We have interagency standard committee that they have a guideline for mental health in emergency settings, but their platform is in-person one, the traditional one. Still, we don't have a platform for totally online and remote mental health assistance for humanitarian crisis. So we did this initiative. We published our protocol that we explain it, what's eMHPSS and how we are doing this and how this support advantages, challenges, everything. We have published this protocol from Lancet Psychiatry, and the other papers is also under submission from other journals about the eMHPSS. So why we initiated the eMHPSS, why it's important. This program or this project is purely for humanitarian settings. We have digital mental health for different settings, but eMHPSS is purely for humanitarian settings. eMHPSS stands for Electronic Mental Health and Psychosocial Support, a project to design a leverage digital guideline to provide mental health services during the humanitarian context. For example, in the recent conflicts in Gaza, Israel, Syria, Lebanon, people suffer from different types of psychological problems, but due to logistical barriers, securities, nobody at the individual level and at the NGO level could go there provide the mental health assistance because it was very risky. So the digital mental health is helping to to reduce these barriers and providing the mental health assistance for people in need, especially displaced population, including refugees and IDPs in the conflict zones, to receive the mental health assistance without delay. And our aim and objects of the eMHPSS is to create a scalable, efficient, and accessible mental health support with the areas with limited infrastructure, and to reduce stigma also associated with the mental health by offering confidential, remote, and access to the service, and providing immediate intervention. This is very important because during the humanitarian problems, crisis, natural disasters, people need immediate assistance like psychological first aid, emotional support, psychotherapy, group therapy, and structured and unstructured psychosocial support. If you are not providing immediate support, sometimes people will suffer from severe psychological disorders, and this may be transferred to the to other people and generations. So the eMHPSS, without any barriers, directly providing assistance, because the traditional one is very difficult. You have to go there, you have to hire people, you need the office, you need assets. So it's very, very hard and very time consuming. But eMHPSS is already ready to provide assistance. The importance of eMHPSS, as you know, during the war zone and the refuge campus, in the IDP campus, in region affected by natural disasters, providing mental health assistance is critical. So that's why eMHPSS is directly joining to provide the mental health assistance during crisis without any delay. So our eMHPSS enables to timely intervention, as I said, through our digital platforms, providing mental health care to these people in need. So without delay, eMHPSS is providing assistance. So eMHPSS is still in action. We are working on this. We have a paper and 2 papers, and we are working on the 3 one. So still in the action, we are doing at the first stage, we are doing the Delphi study to, conducting a Delphi assessment to get experts' input about how to develop the eMHPSS protocol and guideline in humanitarian settings. We are going to do when we finish our SOP guidelines, we are piloting to restricted and conflict zones like Iraq, Lebanon, Syria, and Gaza, maybe Ukraine. And then the project is focusing more on the service emergency and humanitarian settings. In the humanitarian settings, we have emergency phase and developmental phase or livelihood phase, but the eMHPSS is immediate emergency assistance in humanitarian settings. So after the situation get mitigated, so maybe the eMHPSS is not, we cannot provide it, maybe the people can go to the real person psychologist. So this is our diagram and how we are going to work on the eMHPSS, how the projects, the studies and developing the tools, guidelines going to be created for the eMHPSS. We are following this guideline. So the eMHPSS have a lot of benefits. First of all, increasing accessibility, as I said. For example, if we are working in Syria and Lebanon, at the same time, we can work throughout Syria, throughout country. So if we are going there, doing the in-person assistance, maybe you are just working in the small location because you don't have such capacity in terms of budget and in terms of human resource. We are working in the city or some small areas, but digital mental health increase accessibility throughout the country. Everybody can receive the online assistance. And yes, eMHPSS reach people in remote areas and areas with lack of access to the mental health, lack of access to the mental health professionals and services. It overcomes traditional barriers, including, as we said, stigma, or people maybe they don't want to go to the therapy or mental health assistant due to the confidentiality or some other, traditional norms and rules, but eMHPSS can overcome these challenges. eMHPSS for deployment is very rapid. As we said, if some area needs the mental health assistant, directly the online assistance available. No need to go there to establish the community centers, hiring people, taking permission from people from country, to work. So you don't need such such challenges. eMHPSS, because it's immediate mental health assistant, it helps to reduce long-term effects of the psychology, the impact of psychology on people and their generations. Because if someone needs mental health assistance, especially the suicidal people, they need immediate assistance. If you are not providing, maybe they commit suicide. If they have trauma, if you are not providing the trauma-informed care, maybe this trauma will be the post-traumatic stress disorder. But eMHPSS try to prevent from long-term impact on mental health assistance. Also, it's cost-effective. The eMHPSS is cost-effective. If someone, as mentioned earlier, if the NGO or foundation want to go like for Gaza to provide mental health assistance there, they need a big budget. Maybe they need to rehabilitating the hospital, creating the community centers, hiring a lot of people. They need cars for transportation. They need stationery. I don't know, everything. It's cost effective, but digital mental health, eMHPSS, no need such costs. I can provide assistance here from my home to Ukraine, to Lebanon. I don't need to travel. I don't need office. I don't need stationery or anything. So it's very cost effective. So that's why I'm sure the NGO, WHO, and other agencies will love eMHPSS, because they don't need to allocate a very huge budget for providing mental health assistance. So this budget just come back to their pocket. This is a brief introduction about our project eMHPSS for humanitarian settings. So our project still in the process. We are very ambitious about this project, and we want to make it standardized using by all the eMHPSS actors in humanitarian settings. So we want to make it a global project. We don't want to just be on our name. So we are still happy for collaboration and partnership. Anybody would like to learn more about our project, eMHPSS project, our papers, and want to join, please feel free to email me at deria@exxon-foundation.org, or you can just visit our website. We are working for Exxon Foundation for Research and Development, and this is our website. You can learn more about our projects and be in touch with us. So thank you so much for your listening, and I'm happy to answer you. I'm happy to answer any questions if you have about the eMHPSS. Yeah, thanks.
Thank you so much, Daria. And yes, just reminding everyone to utilize the Q&A function if you do have any questions, which I'm sure our audience does. So our next speaker is Professor Hauger eMHPSS, holds a PhD in applied computing from the University of Buckingham, UK. He is an instructor at Koya University and the Dean of R&D Centres. Hauger has presented at numerous IEEE, ACM and Springer conferences and has over 50 publications in top journals, including Elsevier, PeerJ, IEEE and ACM. His research focuses on mining technologies, smart algorithms, and their applications across different fields. Professor Hauger is now going to give a presentation on the development of a new chatbot for Kurdish-speaking populations. So welcome, Professor Hauger. Over to you.
Thank you very much, Ms. Fiona, and thanks for the first speaker, Mr. Daria, about the digital mental health project. And he went to some details about the digital mental health. Well, specifically for my case, I'm focusing on especially on the mental health chatbot for Kurdish community population. So maybe you are, can you see my screen, I think? Is it fine, Ms. Fiona? I think it's shared.
Yes. Yes, good. It's fine. We can see.
Let me start. And through the presentation, I'm going to briefly introduce the main well, this is the outline of the presentation. It's something like a word cloud of my presentation, that I'm focusing on the AI tool, first of all, and then what are the challenges of AI tool, because generally the AI-driven tool for the mental health is a part of the digital mental health. As Mr. Deria went to the details of the advantages and the challenges, well, in somehow there are some difference between the AI tools if we compare with the other technology tools. And more or less, I will go to the advantages of the AI tool or chatbot, let us say, the challenges, and then what are the advantages, and then, well, I'm talking, as I said, specifically for Kurdish community. Why? I will let you know that why I'm focusing on this community. So first of all, I mean, as Mr. Deria mentioned about the digital mental health and why the digital mental health with this during, I mean, this century is very important. And beside this, yeah, the AI tools like the chatbot for the mental health, not only for the mental health, for all the sector of our life is very important today. So as we know that the chatbot is a tool that let the users ask to chatbot, and then the chatbot, based on the trained data, will answer the specific questions. There is some kind of mining or learning or training about the data that previously has been used to train the chatbot. So, but for the Kurdish community, for Kurdish language, by the way, we have a huge number of dialects of Kurdish language, like the English language, as we know that if we take the UK as an example, there are more than 4 or 5 dialects starting from the England to the Scotland and go to the Ireland and then go back to the Wales. I don't know. I mean, as I have been in UK, I faced with this speaking style or the dialects and so forth. The same thing is true for the Kurdish language. So first of all, the first challenge that we will face it in the future for the Kurdish language is that we need to constructing a big corpus, not only for the mental health, for the general, because we need to learn the chatbot. If you see the chatbot like a baby, to understand this, I mean, the baby, we need to train and train and train and train based on the big, let us say, corpus. If we take an example like the ChatGPT, according to their speech of their developers, say that the ChatGPT, let us say, it's what it's let us say a part of the OpenAI company say that is about more than, I mean, their data, I mean, their models, sorry, their LLM models, I mean, the large language models are trained by more than 400 terabyte text, voice, and images. The DeepSeek as well, and the Meta AI belonging to the company of Facebook and Instagram, and so on and so forth. So how about our tool? I mean, how about the LLM of our case? How would be? Which is, it's not clear till now, because the other problem that we have of Kurdish language is that still we need to standardize the language itself and the speaking style and the dialects, not theoretically, while empirically we need to standardizing the language. I mean, we need to standardize the language inside the LLM language. By the way, LLM is the large language model, like the, as I mentioned, like the Llama, like the OpenAI LLM, like the, well, I mean, there are many types of the LLMs based on the transformer or encoder and decoder concepts. So the other challenge for Kurdish community is the standardizing. After constructing the corpus, we need to understanding the LLM to how standardize the language in terms of if user came to ask our chatbot mental health, it should understand very well how the user is understanding, because might be sometimes the user just ask the chatbot in terms like, I have this disorder and I have this symptom, So in terms of grammar is not correct because we are talking about AI mental health for different kind of persons from academia, from the market, from anywhere. So we need to standardizing the grammar of the language. When the user asks the question, maybe in terms of grammar, there are many type of typos or spelling check issue. So that in the background, the LLM should understand and correct these issues. And also the other challenge that today is available, like a GPT, for example, for the users, they need to pay if they want to ask the question, and the ChatGPT should answer in details without any limitations. Of course, there is, there is some kind of, for example, here there is a free option, okay? But when this option is very limited in terms of answer tokenness, in terms of, maybe the light LLM will be available here, but the professional one and unlimited access, unlimited tokenness for answering the image, for generating the images, and so on and so forth, will be available. You have to pay. So our mission is that, and it's our ambition, to create a mental health AI chatbot freely and will be accessible for the Kurdish community. And also, unfortunately, in the developing country like in Iraq, or specifically Kurdistan region, we need to, let us say, make a reclam or marketing about, we have to convert our mindset to the modern mindset. As we know that the traditional mindset takes time, wasting time. How to, let us say, understand the users, that please, you can use the chatbot and you can understand them. What are the, let us say, advantages of AI tools specifically for the mental health? So this is another challenge, and the other challenge is wasting time, as I mentioned. Why? The traditional one, it takes time to go to the clinician, or I don't know. Sometimes the users may shy to go to the clinician. So at that time, within their phone, their electronic devices can ask the chatbot without any shying, without any obstacles in the way to the clinician. As Mr. Daria said, that especially during the wars, you can use these tools very easy without, it's something like on the go. This is another challenge. So these are the challenges, as we believe. And it's clear, as Daria said, that there are many support or enhancing mental health in different terms, especially if we have a tool, if you have AI tool, let us say, because one of the characteristics of AI, or let us say LLM model, is that personalized learning. There is an option, or we can add an option. During my life, I will ask the chatbot within, let us say, billion times. At that time, the chatbot knows very well about my history, about my cases, about my questions, and it's something like a copy of you, and will, let us say, guide you about the treatment and so on and so forth. Well, as I said, it's something like a friend beside you. I mean, at that time, it's something like a parent. Sometimes the user is, our boys and girls ask their parents to, let us say, his or her cases during the daily life activity. Maybe let us say, kids face it, or not only the kids, in general, our guys will face some disorders during their daily life activity. Then they ask the chatbot, is something like a parent, to advise or guide them to, let us say, I don't know, to sleep very well daily, to neglect or ignore some cases which have been faced by the user. is something like a friend. When I say friend, because the best way to solve your problem, you have to ask your good friend. So, I mean, beside all these advantages and challenges, yeah, they have another issue about the general, not only for the mental health, the ethical concern and the data privacy. So our belief is that sometimes when you try to ask the chatbot, well, I'm sorry, not the chatbot, if you have a platform to ask the data about yourself, to send your data, daily life data to the platforms, then someone there knows very well what's your cases, especially if you are talking about a very, well, I can't say very important person's VIPs. I mean, let us say the political man or woman. She or he does not need to send the data to somewhere. You just ask the question with the chatbot. You can ask the data about the disorder types and symptoms. Well, you don't know what's the disorder. I mean, the chatbot is something like a clinician knows very well what's your disorder types. But when you send the symptoms, then suddenly the chatbot will answer you with the disorder types and the treatment is, and many more data. So the chatbot, in somehow, if the LLM train it very well based on the correct or right way, then the issue of ethical will be reduced. Because one of the big challenge of AI tools is the biasing of the data. So that's why the step of training the LLM is very important to put the correct data. Then at that time, the chatbot, when it's trained very well based on the correct or true data, let us say true treatment of the disorders, then the chatbot will be answered truly. So the other question, so how can, let us say, AI will help the Kurdish community in terms of complementing the traditional mental health? For example, as Mr. Dalia said, that improving accessing to care. I mean, at that time, we don't need to go to the battle of the war. We just through our chatbot can ask, let us say, the chatbot then will receive the answers. Sometimes we have a problem with the clinician in terms of their language, not only, I mean, the English one, the style of, let us say, speaking of the, because, for example, because my background is related to the software and technology stuff, when I go to the clinician or the doctor, when say something I can't understand because I didn't learn it from him or her about what's the meaning of, let us say, this is a treatment and you can, but if you, as I say, personalized learning with the chatbot understands very well about what's your problem of understanding of the language. So this is somehow supporting the, or let us say, AI complementary for the traditional one. And also, as mentioned, Daria said that reducing stigma. When I say Kak in Kurdish, it means that Mr. So when, I mean, Mr. Daria also mentioned that reducing stigma. And also, we have, this is some kind of the disorder questionnaires about, I think this is not belong to my specialist, but according to constructing this corpus with Mr. Daria and his colleague, they sent me this kind of questionnaire, which is very important to understand what's the level of the disorder, PHQ-9 and GAD. This, so we can constructing very user-friendly because this is some kind of user interaction. Here we go. You have to type, I don't know, and it's a big picture. But if you look at this, let us say this application, this is somehow our future application through the smartphone. You can ask the question and then step by step, the chatbot will ask you just by options. For example, feel nervous or I mean stressed, not at all, sometimes, most of the, so this is some kind of measurement is I'm leaving for you guys as a psychology, but as a clinician, I mean the chatbot, just imagine this is a clinician will at the end, after this questionnaire list of questions, tell you this is the treatment, this is the I mean the guide is for you for the daily life activity, I don't know. And also the other issue that you can support, by the way, when I say that the user asks most of the time I say the user is the user. The user, it might be the clinician, by the way. I mean, for the mental health, especially when you are a clinician, you can use this app to enhance your decision. And before to making the decision, the chatbot will, let us say, remind you some things that may be forget during your interview with the, let us say, patients. Okay, so yeah, of course, I mean this kind of AI chatbots will help you. So the time is, I have to go very fast, but we need to focus on this issue as well during implementing or deploying the chatbot. We need to take account, we need to consideration about how the application will be very light, so that, because when Mr. Daria said that when you go to, when you talk about the war area, do you guarantee there is an internet there? If it is there, you have to focus on the lightweight application. If it's not there, there is an SMS, okay, way to send, well, the question and then through the SMS. And we have been using the SMS in many applications, in a traditional, let us say, applications. But the whole thing, I mean, is that how the chatbot will be available every time and at any time. Well, everywhere and every time. And also, maybe the community will not famous with the, let us say, chatbot applications or something like that. We can deploy our future, let us say, chatbot for Kurdish community with the social media chatbot channels like that. Well, I mean, the Twitter is, I mean, the Meta applications like the Facebook, Instagram, and so forth. And also the community NGO will have, well, this is our belief that can help the community, not only the local, sorry, I mean, even the global NGOs will can support the Kurdish community to deploy this application, this chatbot. I mean, all the clinician or the scholars can deploy their application on their platforms. So at the end, I can say that, well, this is a very important, by the way. Chatbot cannot replace therapists or clinicians 100%, okay? I mean, but in some cases, we can utilize the chatbot as a therapist. And also the NGO, I mean, the local NGO or the global NGO will support this project has a positive impact on the community. And also, finally, as I say, and I will repeat it again, ethical concern and the privacy data is very important, because we can design and construct our chatbot based on some condition or criteria that when the user asks this question, we can just send or encrypted data, so that you know that there are some security issue in the way. When the user asks the question, this data will be go through the network routers and so on and so forth. We have planned to encrypt the data, and also we have planned that trained the LLM about solving the issue of ethical concerns. Okay, guys. So for me, for today, that's all. And thanks.
Thank you, Professor Halgu. I'd now like to ask Daria to join us back in the webinar. A reminder to our audience to drop your questions in the chat. I have got a couple of questions that I want to dive into, conscious that we've got about 15 minutes now. I think what you were describing in terms of the way in which people can communicate with the chatbot and how also the chatbot comes, an immediate question came to mind, and I think Daria mentioned this earlier, is around sort of, there's a question about digital literacy, but there's also a question about mental health literacy. So when we think about how individuals are describing how they're feeling, if they're not used to describing it in terms like I'm stressed or I have a bit of anxiety, how have you worked with users to reflect the day-to-day language that they may use to describe something that may be going on with their mental health, but they don't necessarily have the terminology?
So, Miss Fiona, you know, because such kind of, which is a very, I mean, it's something like a challenge for our team, for our project. At that time, we have to, a timeline. I'm sorry, a guideline, as Mr. Delia said, that we can learn the LLM to take this issue into the consideration. I'm sure that the chatbot will face this issue, and we have discussed, I think, with Mr. Delia. So according to the guideline that we will use as an input for the chatbot and the LLM will solve this issue. I mean, without, as I mentioned during the presentation, yeah, the user, because due to their, let us say, traditional mindset or let us say due to few experience with the technology or the application, modern applications, we can, first of all, as I said, through the guideline, you can marketing and reclaiming not only our team, the NGO, if the NGO come to participate this, let us say, project will make them reclaiming or marketing how the application is used, how the application is guaranteed to keep your data as a data privacy, and will solve the ethical issue and so on and so forth. This is my opinion.
Daria, did you have anything to add on that point around the language that people are using and some of those cultural sensitivities?
So yeah, one of the main concern we have for this chatbot is language. So we need to train this LLM to be very fluent and to recognize the sensitivity, to recognize, you know, the signs and symptoms for psychological disorders in Kurdish. So we already did that. We trained this chatbot. We added many Kurdish books, many Kurdish dialects and vocabularies. So to be to detecting, you know, the sensitivity, the signs and symptoms for this, the disorders and the stories that people are talking to this chatbot. So we are in the backstage of this chatbot. We are working more to, you know, to make it fluent in terms of language, vocabularies, you know, help people, you know, because we have different dialects, we have different people, how to talk to them, to this chatbot may be challenging for them because this chatbot cannot, you know, understand every vocabulary and dialects in Kurdish. But in the backstage, we are trying to add more books in Kurdish and more terminology, more paragraphs, you know, to be fluent and understand every aspect for, you know, these people that want to chat with this AI clinician, let's say.
Well, sorry, can I interrupt, Ms. Fiona? By the way, I want to mention this. I mean, parallelly with this digital mental health or Kurdish community chatbot for mental health, we have another project which is called Constructing Big Corpus for Kurdish Community. So we gathered a huge number of professionals in terms of language sensitivities, okay? So they are very professional in Kurdish grammar, in Kurdish spelling, in Kurdish, blah, blah, blah. So, because this is not our background, but when we understand the problems of Kurdish language, then they will guide us as a rule-based, let us say. Then, fortunately, we have this parallel, which is in running now, to collecting, let us say, we are starting with the academic document Kurdish. Then we will later on we will collect the text or the voice or the image from the social media, and then when we have a good, as Mr. Daria said, we have a good enough, let us say, data to train the LLM, then the LLM will solve this issue.
Thank you both. I'm just going to go over to one of our participants' questions, Kate. It's a follow-up to a question you've already answered, Daria, on the Q&A function. But one of the follow-up questions to the question of challenges with initial uptake is, do you find that it's challenging to encourage people to enter that environment to begin with due to their own internal views or struggles with accepting support for mental health? So, for example, I understand, this is Kate, that even the word mental in some Muslim communities is surrounded by stigma.
Yeah, thanks, Katie, for this question. This is a big challenge we have, stigma. You know, stigma is a global issue, but especially in the Middle East, in the traditional communities and, you know, communities with majority of Muslim people, we have stigmas around mental health, and people, they choose to go, you know, to wrong direction over to seeking support from mental health professionals. You know, I mean, they rely more on spiritual stuff. But even if you are providing the in-person mental health assistance, stigma is challenging. So during my experience, when I worked with the humanitarian settings as a mental health specialist and consultant, so before when we go somewhere, before providing mental health assistance, we are doing the awareness campaign, you know, just, you know, introducing about how important to seeking mental health assistance, how bad if you suffer from mental health disorders, you stay without seeking support, and talking about our services, the benefits and importance of our services. So for the digital one, we are doing the same. First, before we are providing the mental health assistance, we are doing awareness campaign and introducing our services, our assistance, and introducing our people. You know, the awareness campaign through the social media, TVs, podcasts, and everything. So in my experience, I can say this is very effective, because I remember in one of the camps, so people was very traditional. They totally rejected for mental health actors to go there and provide assistance. But after some awareness sessions, they understood how important and mental health assistance, and they came to join. So I think first of all we need to do you know, big awareness campaign to grab attention of people to seek assistance, and step by step, and I can say we can, you know, overcome this.
And you touched upon it, Professor Hauger, but in terms of that awareness campaign, and again coming back to this point of digital literacy, at a global level, there is obviously a conversation around use of data, how the sort of the chatbots learn, and, you know, the extent to which someone is or isn't aware of what people are making available when they're having these interactions. How has your awareness campaign started to factor in some of those issues?
Well, yeah,
data in
I mean,
particular?
it's very interesting. Well, a point. Well, it's an issue, by the way. I mean, if you go through the ChatGPT, let us say, at the bottom, when they say that ChatGPT can mistake. This is true. I mean, but the ChatGPT has been, let us say, or the DeepSeek as well, is, let us say, trained based on the cloud data. So that's why we are starting with this project with Mr. Daria and with his team. Because when you go to the specific, let us say, specialist, like mental health, at that time, and if the LLM is our own, let us say, implemented software, then we have to use the data of the textbook as we have a huge number of textbooks related and talk about the disorder types and I don't know, I mean, many types of the disorders, the treatments, and also we have planned to ask the clinician, let us say, to give or to provide us, let us say, the data of the patient. Okay, then we will use this data to train the LLM model. At that time, the LLM model is something like, just imagine, when we talk about the LLM or chatbot, is something like 5,000 clinicians at the front of you. When you ask the question to these 5,000 clinicians, okay, they are agreed on a specific answer. Well, that true specific answer, okay? Then when you will receive the answer, it will be much better than a single or alone clinician. Okay, so I think this issue will be solved by this plan that we have it. Okay, because I will give an example. Okay, one day I asked the Python GPT, as you know that the OpenAI within the ChatGPT, they deployed a huge number of GPTs. Each GPT, let us say, related to for a specific thing. Okay, when I asked it the Python one in terms of generating a code for me, okay, it provided me and I use it and I run it on my desktop. Okay, when I came back to the ChatGPT, because I got, by the way, I got an error in terms of semantic error, okay, of the software code. When I went back to the ChatGPT, the Python one again, I say that I have got this error. This is the solution, and he provide. I mean, in the ChatGPT Python provides me the correct one. I mean, we can use this some kind of correcting the error itself by feedbacks. Okay, this is another way. For example, as I mentioned during the presentation, the clinician, when asked the question, the chatbot, and the chatbot gives the wrong, let us say, treatment, the clinician has some idea about the correct one. Then the clinician will feedback the chatbot. Step by step, this chatbot will be learned more and more better.
Yeah, I think, yeah, it's I think AI and large language models are so interesting, because I was going to ask a question about sort of user engagement and experience, but I guess in this context, you've got continual user engagement and experience because they are feeding in to the large language model. Because I'm really conscious of time, I want to ask a question from Vikas. Have you considered fine-tuning your own chat model on top of an open source LLM? Also using a mini model or small language model that can be installed on the phone without the need for internet access, but is specially trained on emergency support for eMHPSS?
Well, we have already downloaded and we have already written the LLM model, not for the mental health, by the way, for the different sectors like the, for the health is a COVID one. By the way, we have published a research during the COVID to take the images of the lung, and then the model, LLM model, will tell you that you have faced with this. This is like a COVID-19, and this is the area of infection. Then this data or this answer will support the doctor or the clinician to make a decision. Well, but our plan is that fine-tuning a specific LLM just for the mental health. At that time, the LLM will be lightweight, not a very comprehensive data trained. At that time will make a mistake. But if we make specialist for the mental health, the time will be, let us say, I mean, the time of answering the question will be very fast than if we compare with the other large LLMs. Well, when we say LLM, is the LLM at the end is a large. We need a huge data to train the LLM model. But when we simple LLM, I mean, at the end is the LLM. But when we simple, it means that specifically we train this chatbot or LLM just for the mental health. Yeah, of course. I mean, we have a planet, but the issue that we have, and the reason of, let us say, announcing this project, we need a fund, a grant to what? To ask the developers in the market to according to our plan, please, according to our design, please, we need to implement, or let us say, translating that, let us say, the English books and English textbooks to the Kurdish one. We need the time, we need the fund to translate these books. And also when we have the data, we need a developer team to what? To, let us say, re-implemented this, because at the end, when we try to specify the LLM for the mental health, we need to fine-tuning the architecture of the current LLMs. Okay, for the Kurdish community language. Okay, so yeah, we are suffering with the fund. That's why we are looking for the NGO to support us, to fund us to run the application, hopefully.
Thank you, Professor Helge. We are at the top of the hour, so I just, and unfortunately, I could continue to talk to you about this. I've got so many questions in my mind, but I would like to say a huge thank you to you both, Daria Ahmed and Professor Helge Madid. We are so grateful for you coming to talk to us today about your work and about the project. It's so interesting. I know that some of the audience are particularly interested in this idea of engagement strategies prior to the implementation of these technologies and how you build that trust and literacy. To our audience, thank you so much for your participation, asking questions. And it's just for the final thing for me to say is have a wonderful day or evening ahead wherever you are in the world, and we will see you next time. Thank you.
Thank you very much, and thanks for your time.